हेलो फ्रेंड्स, वेलकम टू माय चैनल। आज का हमारा टॉपिक है एब्रप्शियो प्लेसेंटा। व्हाट इज एब्रप्शियो प्लेसेंटा? It is the premature separation of placenta that occurs late in the pregnancy. So abruptio placenta is also known as placenta abruption. Is the premature separation of placenta that occurs late in the pregnancy. Pathophysiology: the placenta has been implanted in the correct location. For some unknown reason, it suddenly begins to separate, causing bleeding. This separation would occur late in the pregnancy and account for 10% of perinatal deaths. So this is the pathophysiology. Risk factors: high parity. A woman who has given birth multiple times predisposes herself to abruptio placenta. Short umbilical cord. A short umbilical cord could cause the separation of placenta, especially if trauma occurs. Advanced maternal age. Women over the age of 35 years old have a higher risk of acquiring abruptio placenta. Direct trauma. Any trauma to the abdomen could cause a separation of the placenta. Chorioamnionitis. This is an infection of the fetal membranes and fluid that could predispose the woman to premature placental separation. So these were the risk factors. Now we'll see what are the types. The types of abruptio placenta are measured according to the degree of placental separation that has occurred. So these are grade 0, grade 1, grade 2, grade 3. Grade 0, no indication of placental separation and the diagnosis of slight separation is made after birth. Grade 1, there is minimal separation which causes vaginal bleeding, but no changes in the fetal vital sign occurs. Grade 2, moderate separation occurs and fetal distress is already evident. The uterus is also hard and painful upon palpation. Grade 3, extreme separation, maternal shock and fetal death is imminent if no interventions are done. So these are the types of abruptio placenta. Sign and symptoms: sharp stabbing pain. A woman may experience pain in the upper uterine fundus as initial separation occurs. Heavy bleeding. This usually happens after the separation of placenta. External bleeding will occur if the placenta separates first from the edges. Internal bleeding will occur if the placenta separates from the center because the blood would pool under it. The uterus is tense and rigid, most often called as Caldwell uterus. It appears as board-like, hard uterus without any bleeding. So this is a sign and symptom: sharp stabbing pain, heavy bleeding, and the uterus will be tense and rigid. Diagnostic test. Diagnostic procedure will be enforced by the physician to finally diagnose the presence of abruptio placenta, HB level, and fibrinogen level. These tests are performed to rule out disseminated intravascular coagulation. Medical management: to avoid worsening condition, medical procedures are implemented for both the mother and the fetus. IV therapy, oxygen inhalation. IV therapy. Once the woman starts to bleed, the physician would order a large gauge catheter to replace the fluid losses. Oxygen inhalation delivered via face mask. This would prevent fetal anoxia. Fibrinogen determination. This test could be taken several times before the birth to detect DIC. Surgical management. Once a condition has reached a stage that might endanger the life of both patients, then the surgical management is put into action. Caesarean delivery. If birth is imminent, it is safest to deliver the baby via caesarean delivery. Hysterectomy. The worst outcome would be for the woman to develop DIC, and to prevent exsanguinations, a hysterectomy must be performed. Nursing assessment. Assess for signs of shock, especially when heavy bleeding occurs. Assess if the bleeding external or internal. Monitor contractions if separation occurs during the labor. Obtain baseline vital signs. Assess the time the bleeding began, amount and kind of bleeding, and the interventions done when bleeding occurred. If it started before admission, assess for the quality of pain. Nursing diagnosis will be deficient fluid volume related to bleeding. During premature placental separation, interventions: place the woman in a lateral or not supine position to avoid pressure in the vena cava. Monitor fetal heart sounds. Monitor maternal vital signs to establish baseline data. Avoid performing any vaginal or abdominal examination to prevent further injury to the placenta. Valuation. Maternal vital signs are all within the normal range, especially blood pressure. Urine output should be more than 30 ml per hour. No bleeding or minimal amount of bleeding was observed. Uterus is not tense and rigid. Fetal heart sounds are within the normal range. So this was about previa placenta. I hope you like the topic. Then please give your feedbacks in comment section and please like, share and subscribe. Thank you.